AM 1430 KRGI 105.5 FM. Good morning. I'm Brian Gallagher. We have a guest in studio from Central District Health Department. Andrew Hills is back to see us after Christmas. How'd your holiday go?
It was great. It was great. Family was round. Ate way too much. It was excellent.
And then snow put a little frosting on the whole celebration.
Then spend the rest of Christmas Day shoveling off my driveway. It was perfect.
It's a holiday tradition.
Yep.
We're here actually to talk about some of the year-end things that you can take care of for your benefit, because we still need to make sure that health is a high priority, and we're not done with all of the cooties that are out there trying to make us ill. So I'll let you talk about some of the things you have available from Central District Health Department that can help the cause.
Well, let's start with the importance of making sure we're vaccinated. We're still in flu season. There's a lot of flu going around. We have a very high rate of COVID at the moment. We monitor wastewater results, and the amount of COVID in the community is as high as it was in March and April. So it's right at its peak at the moment. So if you haven't had either your flu or COVID shot, now is an excellent time to come and get it. And if you're in the risk group for RSV, we do that vaccination as well. Speaking of COVID, I wanted to bring in, I know visual cues don't work well on radio, but I brought in a box of IntelliSwab COVID-19 rapid test kits. It's only about a 9 by 4 inch box. There's 2 test kits in each box, and we have a quantity at CDHD. These are free test kits. There's 2 tests in each box. They're free to the public. They can be used on anyone for 2 years and up. If people need a test kit, if they want to get one, they can come and collect one from us. Just come into the front office and ask, and we'll get you those. They're really easy to use, just 30 minutes. You can even report your results if you want to, or you can just keep it to yourself. That's fine. COVID is still here. It's still serious, and it does kill a lot of people, sadly. So you will want to know if you have COVID. You might be asymptomatic and yet still have some of the residual effects of it. So this will give you peace of mind. You can use 2 kits if you're asymptomatic to show that you don't have it. I traveled for Christmas. I had family around. I'm traveling to see other family for those delayed Christmases where you can't all quite get together in the same place. You want the peace of mind that if you have it or don't have it, that you're not going to spread it, or vice versa.
With all of the celebrations that were going on, I know I saw a lot of masks out there. Some were precautionary, but for some, these were folks that were affected earlier during this pandemic. And as it lingers, they know that it's not done. We know it's not done, and it's good for you to know that it's not done. And so being cautious is still a good choice.
Yeah, I mean, it's not going away anytime soon. What are we in now? We're going to enter year 4 of this. It's not going to go away. This is going to be with us, until there's a permanent solution to it. In the meantime, we are doing what we can with vaccinations to protect people. But the most important thing is to know whether you have it or not. This has been a difficult virus because of the problem of people being able to spread it even when asymptomatic. These test kits can detect you even when you're asymptomatic. They aren't as reliable as a lab-based test, but these are free. So this is what we have available, and if people want them, they are more than able to come into the health department and collect some for themselves and their family.
All right, we've talked about the COVID, we've talked about influenza, we've talked about RSV. Are there any other major warning flags up right now?
Now, at the moment, those are the big 3 that we're working on. Flu is a perennial. I think we're all used to having to come and get our flu shots each year. COVID is getting to that step where it's just going to be flu and COVID. And, over the next year or 2, we may well see those getting combined together just to reduce the number of shots we can get. But at the moment, flu, COVID, and I believe this is the first year we've been able to offer RSV as well, which is really important. So
if folks have questions, how can they find out more?
They can come to the health department. They can visit us at cdhd.ne.gov online, or they can come to our building, the old Dresbach's building on South Locust, to get more information or collect some test kits.
Andrew Hells from Central District Health Department. Always a pleasure.
And a pleasure too, Brian.
Good morning from AM 1430 KRGI 105.5 FM.